believe, our foundation believes that we need to look at everything on this planet from an ecological point of view. Most of the time when you go to mainstream medicine, which is allopathic medicine, you have a doctor for the finger, doctor for the nose, doctor for the head, doctor for the hair, skin, everything different things. And that's all you're interested in. Nothing else. It's not the human being. Human being is lost in all of this. In the old days, like Ayurvedic medicine, American Indian medicine, a lot of those things, human being was studied or looked at, observed, perceived in context to what they did, who they were with, what time of the year it was. Many things took part in it. But modern medicine or allopathic medicine has taken it away. We have reduced everything to single parts and pretend as if that's all there is. So you go to a cardiologist, they're interested in cholesterol. You have high cholesterol, you have to bring it down. But cholesterol value, when you get a blood test, is a piece of data, it's a number. It does not represent you. We have no idea why is the number high, because cholesterol is made by the body. And cholesterol is the mother of all hormones. So if you stop cholesterol production, all your hormones will go down. Now, high cholesterol can cause problems, but low cholesterol, people with very low cholesterol have more cancers and more suicides. So, I mean, there is a window for each person which is optimal, or as it's called, the Goldilocks factor, being just right. Anything goes off. So that's what we're looking at. We look at people from an ecological point of view. And to just nail that a little more, ecological point of view, for example, each one of us, our heart is beating. And the Japanese have done studies where they look, when anything is beating fast, it puts an electrical field and a magnetic field. So they looked at that. They found human beings' heart pumping puts out electrical field about 5 feet around you, the field. So what happens when you hug somebody? Your field is interacting with the other person's field. What does it really mean? I don't know. But it just shows us the things which happen. We talk about electrical fields are bad for you, but what about our own field? How about some people, we all have met people, if we go, they're nice people, you talk to them, and you sit next to them, you walk out, you feel drained. They're like emotional vampires. They haven't done anything wrong to you, they weren't mean to you, it's just they're draining. There are other people, you go in and talk to them, you just come out feeling better, even though you may disagree with them. So a lot of things about ecology we don't understand. Or you take 10 women, put them in the same work situation or a dormitory. Within 3 months, they will all pretty much menstruate together. It's something we have known for a long time, but we really don't understand it. And the menstrual cycle works on whoever is regarded as the alpha female. The alpha female may not be the CEO of the organization, maybe the cleaning woman. So even the alpha things is not really, it's more hormone, we just don't understand, but all these things make impact on us. Okay, so when we talk about ecological approach, that's what we mean. And the 501c3 we have downstairs is based on studying this ecological approach and treating patients from an ecological point of view. So anytime a patient comes see us, they are a research subject, every single patient. So by doing that, what we're saying is, you're kind of unique. I don't know what your ecology is, what your family life is, what's your religious life. They all play a part in it. We take that into consideration. And our research spectrum is set at that. Most research is based on, we're just going to study this. For example, almost all the medications in the market was researched on men, not on women. But we use it on women. And what we're finding out, when we use it on women, it doesn't work as well. In the beginning, we used to say, well, they're not taking the medication. But that's a patriarchal view. But we're finding out, like even aspirin, a baby aspirin a day works great for men. For women, maybe up to 40% of the people, it doesn't work at all. So we're giving it thinking we're doing good, but we're not doing anything. So there's huge difference. That's ecology. We have to take people. Or in my talk on hormones, we have talked about how, depending on where in the menstrual cycle you are, it changes the brain activity, how drugs interact, a whole lot of stuff, especially in menopausal stage. But we use one medication, one dose for the whole spectrum of a woman's life. When you do that, you get into problems. Simple things like estrogen. People get estrogen, it doesn't work, they keep increasing estrogen, then they worry why you get cancer. But we know estrogen is related to progesterone. They both have to be in a balance. We know serotonin, if you don't have enough serotonin, estrogen can't work. A lot of my patients who come in who are on high estrogen have problems. We first do a serotonin value. The serotonin is low, we increase the serotonin, and their estrogen level, need for estrogen goes very low.